Informative speech. Asperger's syndrome and autism spectrum disorder. Have you ever gone to a gas station or grocery store and been asked if you wanted to buy a little piece of paper with an apple on it and a place to write your name to help in autism research? Or have you ever been stopped at a red light behind a person who had a puzzle piece magnet stuck to their bumper? I used to see these kinds of things everywhere, but they would pass in and out of my consciousness like so many other things that I either didn't know much about or had little interest in. That was until 6 months ago when I was diagnosed with something called Asperger's syndrome, which is an autism spectrum disorder. Like so many people, I had no idea what any of that meant, but now I had a really good reason to find out everything I could about Asperger's and ASD. An autism spectrum disorder is a neurological condition that affects a person's social interactions and ability to communicate. There are 3 forms of ASD: Asperger's syndrome, autism, and pervasive development disorder. It is estimated that 1 in 166 to 1 in 100 children are born with one of these 3 forms of ASD. It is more common in boys than in girls. Each person will display their symptoms differently, and the severity of the condition can range from mental retardation to above average intelligence. When someone hears that a person has autism, what do they think? Likely the first thought is of a child they may know that behaves badly and seems out of control, either running around screaming and throwing things or sitting in a corner rocking and moaning. While these certainly can be signs of autism and can be the first clue to parents that there may be something going on with their child, there are other, more subtle signs that a person may have an ASD. In each of the 3 forms of autism spectrum disorder, there are common symptoms that include an inability or lack of desire for social interaction and communication, lack of eye contact, having reduced or hypersensitivity to sensory stimuli, repetitive behaviors, and lack of facial expression. It is sometimes difficult to tell which form of ASD a person may have because of the similarities in symptoms. So during the diagnostic process, doctors and therapists will look to verbal skills and expressions. Sometimes parents are prompted to seek help for their child because they do not speak at all or are seriously behind their peers in verbal communication. Often these children will be diagnosed with autism or pervasive development disorder. Those with Asperger's, on the other hand, commonly speak much earlier than their peers and tend to use words that are far beyond the verbal skill level of others their age. It is more difficult for doctors to pick up on the signs of Asperger's. Children with Asperger's usually have trouble making and keeping friends, and often end up playing by themselves a lot. They may seem awkward in social situations and blurt out random thoughts, making it hard to join in the normal flow of conversation. They also tend to be nervous and afraid of everything, and often engage in repetitive behaviors. Sometimes these symptoms are ignored, or the child is labeled as shy or strange. But when professional help is sought, it is likely that these symptoms will be misdiagnosed as an anxiety disorder or any number of personality disorders. The term Asperger's syndrome is taken from Dr. Hans Asperger, who in 1944 documented children with the symptoms I've described. But his findings weren't standardized as a diagnosis until 1994. In contrast, autism has been studied and written about since as early as the 16th century. So in addition to the difficulty in recognizing the symptoms of Asperger's, there is also a lack of knowledge about this syndrome in the medical field. Recently, the activism of people like Doug Flutie and Jenny McCarthy, whose children have been diagnosed with an ASD, have brought some public awareness to Asperger's syndrome, as well as the book Look Me in the Eye by John Elder Robison. Mr. Robison describes his life with undiagnosed Asperger's. He is one of the many adults who have lived and coped with the symptoms of Asperger's syndrome without knowing why they are different. Because of the increase in the knowledge and acceptance of this disorder in the last few years, people like him have been able to finally understand the different way in which their minds function. The most important thing to know about ASD is it's not a disease, it's a disorder. There is no cure, but there is therapy and educational tools that can help. Depending on the severity of the symptoms, this can include speech, social, and behavioral therapy. For adults with a previously undiagnosed ASD, therapy may not be required, as they may have already developed coping skills and have usually integrated themselves into normal life. Some people will need medication for the symptoms associated with their disorder, like stress or anxiety, but there is no medication for ASD itself. All of my life I have been called strange, odd, weird, and quirky. I've never had many friends and have spent a good part of my life trying to figure out what's wrong with me and how I can appear to be normal to other people. Through this diagnosis and the things I've learned about Asperger's, I have come to a greater understanding of myself and how my brain works. I've been able to accept the differences other people see in me as unique rather than odd. And I feel more normal now than I ever have before. I'm hoping that in the coming years I'm able to bring this knowledge and acceptance to others. I also hope that other people who are like me may find the inner peace I have found through diagnosis and therapy. And now that I have shared this information with you, perhaps the next time you see an apple for autism, you will buy one and proudly write your name on it.